America's great healthcare system is no more. That's the topic of today's Bold and Blunt. And I'm your host, Cheryl Chumley, giving you a Christian conservative look at today's news, politics, culture, and events. If you haven't been to the doctor's office in a while, or a hospital in a while, or ever for that matter, you may not be aware, but America's healthcare system, once the envy of the world, once the pride of this nation's medical community, has been destroyed. And you can pinpoint the time of destruction right at Barack Obama, Obamacare, Nancy Pelosi, the Democrat Party, and Republicans who didn't adequately, properly fight the socialization of America's free market medical system. Before I get into all that, I want to quickly mention, if you like Bold and Blunt, you can get Bold and Blunt at edify.app, the online platform for faith-based podcasts, at washingtontimes.com, where you can subscribe to Bold and Blunt. Just go to the bottom of the washingtontimes.com page, find the newsletter section, click on it, find Bold and Blunt with Cheryl Chumley, and sign up for my 3 times a week newsletter, which will contain my twice weekly Bold and Blunt podcast as well. And guess what? You can get Bold and Blunt wherever podcasts are offered. That's right, Spotify, Apple, go there, check it out, type in Bold and Blunt podcast into your Google or Bing search or DuckDuckGo, whatever it's called, and guess what'll pop up? Bold and Blunt with Cheryl Chumley. Thank you if you are already a subscriber. I want to speak a little personally right now, something I rarely do, but there's nothing that adequately represents what's gone on, what's gone wrong with America's healthcare system, like my own family personal story. So my husband in 2008 suffered a heart attack, which brought him to a hospital in Northern Virginia, where, due to complications of his heart attack and the insertion of a balloon pump in his leg, they had to amputate one of his legs in order to save his life, which doctors happily, helpfully told me at the time would not happen. Pretty much the predictions were for his certain death. And of course, he survived because God is in charge, not doctors, as we all know, right? Especially by living through these last couple years of coronavirus crazy, where we were told everybody would die unless we all had vaccines and wore face masks for the rest of our lives. And we haven't. We're still here. Humanity is still thriving. Anyhow, back to the story of my husband. So after that, it wasn't just smooth flow, right? It wasn't just easy living. It wasn't back to normal, of course. He had been shocked so many times to keep his heart going during this heart attack episode that some of his internal organs suffered and had to be removed. So he ended up having many, many years and years and years of health issues following this 2008 episode. And so over the course of several years, between 2008 and present day, February 2023, my husband has been in just about every hospital you can name on the Virginia coastline, Northern Virginia, from Fairfax on down to Richmond. And this started in 2008, including several helicopter rides, so I can speak to that ordeal as well, until present day. And so we've seen, and of course, when I say we, I'm speaking of both my husband and myself and our 4 children. We've seen up close and personal healthcare. We've seen healthcare and insurance companies and how the medical community treats those in their care before Obamacare. And we've seen healthcare and how the medical community and insurance companies and so forth treat patients after Obamacare. And so there is, without a doubt, a decided, definite, substantial, horrifying in some cases, in some examples, difference between pre-Obamacare and post-Obamacare. And let me give you one example. When my husband initially had his heart attack in 2008, he was flown by helicopter on the way from one hospital to another, from one hospital in Woodbridge, Virginia, to specialists in Fairfax, Virginia. And during the course of his helicopter ride, his potassium levels fell and he fell into a coma. Well, they went into emergency mode during the helicopter ride to try and keep his heart pumping, to keep him alive. He had, at that time, private, through his employer, private medical insurance. And I also had insurance through my private company, through my private medical insurer provider, through my company where I worked. So we had two insurance plans, both private, through our own employers. The cost of the helicopter trip with the medical treatment provided aboard the flight, I don't know what the total cost was to the insurance company, but the out-of-pocket cost to us was about $1,200. And guess what? We paid it off over the course of several months. We paid that off. Fast forward a few years, and my husband had another medical issue where he was brought to a hospital. I believe this one was in Fredericksburg. He was brought to a hospital in yes, it was Fredericksburg, Mary Washington. Stay away from Mary Washington if you can, by the way. Mary Washington in Fredericksburg. And after they kept him in the emergency room for the allowable number of hours that the insurance company would pay, because of course, keeping patients in emergency rooms is great for the bottom line of hospitals, because if you're planning on transferring them to another hospital, you get that, quick billing from the emergency room stay. And if you're planning on transferring them to a hospital room within your own facility, admitting them, you get that quick billing from the emergency hospital stay. Either way, it's great to keep patients just sitting there in the emergency room, because they get to charge. They get to charge quite a bit for that. So anyhow, they maxed out his emergency room visit and then decided that they were going to transfer him to a hospital in Richmond by helicopter. And so they called the handy-dandy local helicopter, and these people loaded him on the helicopter, slammed the door on his foot, not once, but twice. And remember, he's only got one foot, right? He had his leg amputated in 2008, like I mentioned. And slammed his door not once but twice on his foot, broke bones in his foot. It swelled up, turned purple. He had it bandaged for many, many, many months, and then jammed some sort of helmet on his head and took off into the night. My husband thought he was going to die on this helicopter because they provided absolutely no treatment at all. It was kind of like your Keystone Cop type of helicopter. Just get Jim, Bob, and Joe, get their local helicopter in their backyard to go fly patients from one hospital to another. The cost of that ride was tens of thousands of dollars. It was something like, I can't remember if it was like $52,000 or $74,000, because there was another helicopter ride in here with my son. And if the one for my husband that I'm referencing was $72,000, the one for my son was $54,000, and vice versa. But anyhow, let's just say it was the $72,000. No, let's just say it was the $54,000 one. $54,000 to go about 40 miles down the road, right? Where an ambulance could take you for the cost of gas, okay? The price of gas. And so not only did they break his foot, right, and refuse to be accountable for it, because we tried to launch an investigation, and the investigation that the hospital kicked off consisted of this. Well, we asked Jim, Bob, and Billy Joe if they did that, and they said no, they did not slam my husband's foot in the door. And so obviously it didn't happen. Never mind that I had video of my husband's foot in the hospital being bandaged. Never mind that we had photos. Never mind that my husband had absolutely no reason to lie about it. The hospital launched the investigation and found that nope, didn't happen, because Billy Bob and Jimmy Joe, or whoever, the hee-haws who flew that helicopter and slammed his foot not once but twice in the door said it didn't happen. So after that, come out of the hospital and we get this bill because now it's Obamacare days, right? And insurance companies, basically United Healthcare at the time, basically didn't have to pay whatever they didn't want to pay because, hey, there's no competition. There's no free market anymore, right? So they pay about, I don't know, $13,000 of the helicopter, which was exorbitant anyhow, and then stick us with the rest of the cost. Can you imagine? Can you imagine that? And here's the thing. In Virginia, up until a couple years ago, you didn't have the right to refuse a helicopter ride, right? If you're, say, in a car accident, like my son was on the side of a road, and you have a broken leg, like my son did on the side of the road, and the local emergency officials decide that they're going to transport you to the hospital by a helicopter rather than a ground ambulance, like happened in my son's case, with a broken leg, not life-threatening, just in a car accident on the side of the road, you didn't have the right to refuse that. And so you, after your son gets transported to the hospital with a broken leg, not life-threatening at all, and you get a bill for $72,000 of a helicopter ride because the insurance company refuses to pay more than $8,000 for that particular ride, because that, of course, is sensible and $72,000 is not, then, oh well, that's it. That's how the medical community works. And up until just a couple years ago in Virginia, that's what happened. And not just in Virginia, because when this happened to me and my family, I started looking into it around the nation. And guess what? The medical helicopter transport system was a thriving scamming system. People all around the nation were getting socked with tens of thousands of dollars in bills for helicopter transports that they had no right to refuse, because patients were just thrown on the helicopter and off they were whisked into the sky to the next facility for treatment. And then later, as the weeks turn into more weeks, as the bills come in, you get a bill. You get socked for tens of thousands of dollars in helicopter transport bills that were largely unnecessary and that you never approved. And so in Virginia, what they did, the legislative branch in Virginia here, they cracked down on this scammy system and said that now you as a patient, you as someone who is about to be transported for medical treatment, have the right to refuse a helicopter ride. And guess what? Chances are, in the last couple of years, helicopter transportation in Virginia for medical reasons has probably dive-bombed, right? It has probably plunged because now they have to get a patient's permission. And what patient is going to say, yes, transport me 20 miles down the road for $30,000, $40,000, $72,000 instead of taking me by ground ambulance for nothing my insurance will pay? What patient is going to okay that? Well, none in their right mind. So Virginia's cleaned up on that, but let me tell you about the medical community in general, okay? 50% of the nurses and doctors out there honestly do a great job. They're awesome. They're great. They're on your side as a patient. 50% of the nurses out there, I can tell you from firsthand experience, and so can my husband, nurse ratchets, okay? They'll steal your pain medicine. They will lie. They will intimidate you as a patient in your room. They'll send in a gaggle of nurses to stand around in a circle around your bed to intimidate you. They don't respond to your requests for pain or if you have to use the bathroom, or if you need some kind of assistance in your room. If you have to go to the bathroom, I can tell you this, they would rather have you go on yourself in your bed and sit in it than try and get up and go. It sounds disgusting. It is disgusting. But there are hospitals, there are nurses who will let you sit in your own urine rather than come in and change you and take care of you like you think that they're supposed to be doing. The nursing side is that they're overtasked, they're overburdened, they don't have enough staff, and so forth. But the pre-Obamacare, okay, where it was free market, where hospitals were competing to a certain extent for patients, where there was accountability in the system, versus the post-Obamacare, and particularly the post-COVID care, where there's absolutely zero accountability, is completely different. It's a before-after picture that if you have not seen up close and personal, if you have not experienced care in America's health systems, both before and after Obamacare, both before and after COVID, you probably are sitting there rolling your eyeballs thinking that, well, I'm just making this up. But if you have been part of this system, both before and after Obamacare, both before and after COVID, then you know what I'm talking about. And you know that America's medical system, America's healthcare system has fallen, and continues to fall. And the big problem nowadays is there is really zero accountability. If you try and fight for the care that you think your loved one or you yourself deserve because you do, and your loved one does, then your complaints are going to be, first off, on deaf ears, and second off, tossed around and rerouted into this big bureaucratic bloat that is akin to trying to get an answer from the IRS. Imagine having to go to the IRS and try and get answers about your tax forms or your tax bills, and apply that to the medical system today. And that's exactly what you're going through. That's exactly what you face. This is just a tip of the iceberg. I spent too much time talking about the medical air transport, which, abysmal as it is, that's just a drop in the bucket of what happens in the hospitals, in the clinics, with the nursing staff of today's medical system. But my guest today, luckily, has some inside information. He can talk more to this because he's actually written a couple of books about it. His latest is called Medical Politics: How to Protect Yourself from Bad Doctors, Insurance Companies, and Big Government. His name is Dr. Stephen Soloway. You may know him informally as Dr. Trump. But anyhow, here he is right now on Bold and Blunt. Dr. Stephen Soloway, thank you so much for being on Bold and Blunt. I really appreciate your time.
I'm very happy to be here, and I am very bold, and I am very blunt, so thank you.
Great, because that's what we need, particularly on this topic. I got to tell you, when I got this in my email box, the promo for your new book, Medical Politics: How to Protect Yourself from Bad Doctors, Insurance Companies, and Big Government, I sat up and took notice because I just spent 3 weeks battling hospital bureaucrats, which reminded me of trying to deal with the IRS. Tell me why you wrote your book and what people can get out of it.
First of all, I'm sick of dealing with the IRS. Parenthetically, exactly what you said. I've got thousands of patients. I order thousands of tests. I order thousands of medications, and everything's denied. We have socialized medicine. The patient has no chance. The government wants you dead, and they want me unemployed.
Wow.
They've used Medicare they've weaponized Medicare to criminalize doctors. Doctors are afraid to write prescriptions.
Yes.
Management doctors are retiring, going out of business. Gynecologists and anesthesiologists who have high malpractice, they don't want to pay it anymore because they're not getting reimbursed. Understand that even though the private insurance companies pay more, they follow the lead from Medicare. There's some backdoor story. I always say there is the news, the truth, the bullcrap, and then there's the backstory that tells everything. Well, I just haven't figured out yet the exact backstory here, but there is a movement that started with Obama, and this movement is socialized medicine because they think average American that health care for all is a great idea and they spin it their way, then the rest of the world looks terrible and we look great, except all the patients, all the people suffer. You know, some factual information. 100 million people in the United States prior to Barack Obama had Medicare, Medicaid. 200 million people had private health insurance, whether it's Aetna, Blue Cross, Cigna, doesn't matter. That's 300 million out of 330 million people. Of the 100 million that were on Medicare, Medicaid, 15 million were double dipping because they also were covered by the VA.
Wow.
Nobody needs two insurances. You cannot use two insurances at the same time anywhere for any reason, although I will explain why veterans like it. Simple thing to do is to take anybody who is over 65, who is to get Medicare, who has already got VA benefits, and give them Medicare to one of the 30 million uninsured. So now you're down to only 15 million uninsured. When there's 15 million uninsured people, that sounds like a national crisis. However, that's only 5% of the population.
Right.
And with a government printing $5 trillion for this and $7 trillion for that, and the debt rising to the point of $31 trillion because of stupid, frivolous, nonsense, garbage spending, and the interest payments are going to be $8 trillion over the next several years, which is more than the national GDP for 2 years running. We're screwed. The country is insolvent at this point. Nobody's saying it, but it's insolvent. How can you recover from, numbers that are this staggering? So, the simple things to do. Medicine needs to revert back to fee-for-service. The government needs to keep their hands out of it, but more importantly, this system was working fine 15 years ago.
Yes.
And rather than tweaking the few people that needed help, some idiot came along and dismantled the whole system. And that's, now that it was dismantled, you have private equity buying large orthopedic and dermatology practices, which is putting all those doctors on salary, and they can be fired and hired. And the way to stay a doctor is to follow the rules. You have the government giving hospitals money to buy up all the family practices and all the cardiologists. Again, now they're employees, and now they're not able to think. The innovativeness is gone. The entrepreneurship is gone. The capitalist mentality is gone. You need a doctor that can think outside the box and not spend 14 minutes and 59 seconds with you and then leave the room while you're asking a question. You need somebody who understands the box but knows that most problems are not in the box. The speed limit's 65. If somebody needs to tell you to drive 30 in the snow, then you have a problem. The sign is fine. And to get pulled over speeding at driving 73 on a sunny Saturday when you're the only car on the road is also pretty stupid. So I'm using those examples to tell you that's what's going on in medicine. Now, another terrible thing in medicine is you come in here, you have rheumatoid arthritis, you have terrible disease, I can see it from a mile away. I've been doing this 35 years, and I know you need aggressive treatment immediately. And by the way, we're taught in rheumatoid arthritis treatment, early treatment, reverse disease, etc. Well, you get a denial from the insurance for the right drug, and this denial says, you didn't fit our criteria. What's the criteria? You have to take Motrin and Naproxen for 3 months each in maximal dose. Those are toxic, okay? GI bleeds and all the other things that come along with them. The incidence of GI bleeds in arthritic patients is down about 100% since the institution of these better so-called biologic drugs. They are denying the drugs because of the cost, in spite of the people paying their copay and the patient paying their insurance premium and deductibles and everything else. So you're buying a plan that goes up 10 or 15% every year, and you're limited every year, and you have less freedom, less rights, less access to medicine. You don't have access to your doctor because when they're owned by institutions, they're shifted around the system. And frankly, nobody is motivated to let you have a relationship with a doctor anymore because that's not in the best interest of the money people. The money people are looking at the bottom line. But if the doctor looks at the bottom line, then the doctor's a criminal. You're not supposed to be rich if you're a doctor, yet you're supposed to be a rich person to buy all the doctors. That's fascism. You own your practice with the illusion that you have control, and we don't have any control. So medicine, or the United States in general right now, is a fascist country with socialist ideals, and people are getting screwed. And unless you know your senator, your congressman, the CEO at your local hospital, the CEO that owns the place that runs the facility where you get your care, you're done.
Let me just inject something here, because everything that you've said is extremely interesting to me, not just on surface, but it's very personal to me. My husband has had long-term healthcare issues for 15 years or so. In 2008, he had a heart attack leading to a leg amputation, leading to years-long health issues. And so I've seen the medical community move from free market into Obamacare. We have been in every hospital up and down the East Coast in Virginia, and I see exactly what you're describing play out. The medical community has become this huge bureaucracy where you cannot get any accountability or answers to your question. So let me ask you this, because everything you say, I want listeners to know, dead on, 100% accurate. What can people like me, like others, do to fight?
All right. There's a few things. The first thing that I tell everybody, you can't become a patient at an institution. You must go to a self-employed dinosaur who fights for you. The second thing is, you need to vet that doctor by asking your friends and family. Do not go to the top doctor magazine they're bought and paid for. I know. I'm on the list. I'm the longest Philadelphia magazine top doctor in the history of the magazine. Trust me, it's not all that. It's good for advertising. I'm being honest with you. and that's negative against me, but I'm telling you, that list, I mean, I can put whoever I want on or off the list. It doesn't matter. So you need to vet your doctor through your friends and family, okay? That's the fact. And after that, when you get your referrals, if you are in, we'll call it X facility, all of a sudden you have to see every specialist in that facility because the doctors get penalized financially for referring out of the facility. That's insane. You need the best doctor for you, and you need to tell them, because by the way, people don't know there's a patient bill of rights. The patient has to really get what they want. Medicare has a doctrine, and you have to do what's right by the patient. Nobody follows that. Nobody knows that. Nobody looks at that. Nobody cares because it's all about the bottom line and the bureaucracy and the socialism that's running the healthcare system. So back to your question. You vet your doctor. You go to a solo doctor or a group of 3 doctors that work together that are not owned or operated by a hospital or a system. And by doing such, you don't fall prey as easily. Now, again, let's say, you had a heart attack, you go to your cardiologist, and he works for the system. Well, if you want to see a heart surgeon who you think is better because they helped everyone else in your family, you need to leave that system, and you got to find that doctor. And these things are not impossible. It's a matter of making phone calls and being persistent. And frankly, if you piss off the secretary, you know you're doing a good job, because you're pressuring them to go against what they're brainwashed to do, which is keep you in the system, keep your money, keep your x-rays, keep your blood test. And again, you don't count. The quality of care has gone down so poorly, so low, that the people that are practicing medicine that have come out in the last 10 to 15 years, these people are equivalent to the shoeshine guy. Nothing against the shoeshine guy, because they do a good job. But the point is, you're not getting the smartest people. And, frankly, I think the school systems must be corrupt. How is it that half the school people graduating have a 4.0? Let's be serious. So if you get a 4.0, you can go to medical school? Okay, fine. Well, there's more 4.0 students than there are spots for medicine anyway. Those people are smart. They're going to Wall Street. They're going to get a Harvard MBA. Not that I'm pro-Ivy League anymore, because I think it's a joke. The whole hypocrisy of this Ivy League is the woke league. And people should, like Pete Hegg said, return your diploma, tear it up or something. Just learn what you need to know, and don't worry about the connections in the boys' club at all these places. I belong to the Harvard club, and therefore I can meet up with all the other snobs at the Penn club and the Dartmouth club and this club. That's where it all starts. There's a connection here, okay? And people need to fight for themselves and go to who they want, because they do have that right. I hope I was able to touch on this question, and if I left something out, please ask me again.
It's you of course you touched on the question. It's just I don't think most people have as much experience with hospitals as like my family does. Most people in America, you go to the hospital or a doctor when you're sick and you think, well, this is how it is in this particular instance. But what you detail in your book is that it's across the board now, right? The healthcare system in America, the whole system, needs to be revamped.
The way to revamp it is take it backwards to where we used to be 16 years ago.
Right.
Where people went to the doctor.
Right.
And there was none of this garbage where everybody was owned by somebody. Look, from your own experience, and you didn't tell me, but I'm saying, when your husband's in the hospital and you need a nurse, she's on the computer documenting notes, but she's been trained no longer to take care of patients. She's trained to make sure the notes look good, so when the government auditor, which is the IRS, comes in, the charts look fine, we'll pay you. They'll come to my office and they'll say, well, you left out a word, we're not paying you for the whole visit. What do you mean? I gave a flu shot, why don't I get paid for it? Well, we denied the note. So hospitals have spent a lot of money, which was given to them by the government, to train nurses to make good notes. That's socialism. The notes all look the same. And you can't get a nurse. And by the way, when the doctor comes in, you don't know him. He doesn't know you. You want to ask him a question. He doesn't know who you are. He doesn't answer it. Broken English, runs out of the room, and you're pissed off. So what are you going to do? What you're supposed to do, if you're me and you want my advice, you call hospital administration that's on call and you say, look, my husband's here, he had a heart attack, he's sick, blah, blah, blah. A guy came in for 3 seconds, didn't understand what I said, and he walked out. And the nurse, she's busy. And by the way, I was a patient for 6 months, and I wrote about that in my first book called Bad Medicine, where the internal arrangements within the hospital system are disgusting, absolutely disgusting. For one, they're filthy. For two, if you're a large enough system, you're immune to prosecution of any sort. Because I was also on the medical board in the state of New Jersey, and I personally filed a complaint against the hospital in another state, which was an Ivy League institution, and they rejected the complaint by saying that, as you know, we can't disclose our findings, but we found everything to be fine. And it was blatantly ridiculous, because I've never filed a complaint before, and it was only because it pertained to my health, and it was so outrageous.
Unbelievable. Your book is more than just an interesting read. You're providing a very crucial service to the American public right now. And I know you have a specific website that you want to direct people to purchase your book. What is it, please?
Bad Medicine Book. That is one word, badmedicinebook.net. And if you go to that site, whoever's listening, you'll get a personalized signed copy from me, and I pay for the shipping, and it's very simple. There's no reason to fight with Amazon and all these big places. Just direct from me, signed by me.
There you go. There you go. Dr. Stephen Soloway, thank you so much for being on Bold and Blunt. I look forward to reading your book with great interest and putting into practice in my own life some of the principles you lay out. Thank you very much.
I loved being on the show. Thank you so much.
I just went to badmedicinebook.net and bought both Dr. Soloway's books. There are two books there, actually. The first, the one we talked about today, Medical Politics, but then also a second one, Bad Medicine, The Horrors of American Healthcare. Honestly, the unstated title is Thank You, Barack Obama. I want to thank you for listening to Bold and Blunt. If you are a subscriber already to Bold and Blunt, really appreciate it. I appreciate your support. If you're not, you can get Bold and Blunt at edify.app, the online platform for your faith-based podcast, at washingtontimes.com, of course, and anywhere podcasts are offered. Tune in next time, and in the meanwhile, stay blunt, stay bold.